Hello, my name is Michaela Byrne. This is going to be my TED Talk for Aspen University. My topic today is going to be on medication errors. I chose medication errors because it's something that I feel can be prevented with the right amount of precautions. I also believe that nurses are human and are doing the best that they can and are very busy. So to a certain degree, I think they can be prevented, but at the same time, I also understand that we're just human and sometimes we lose track of that. So medication errors remains a prominent issue within the healthcare system. It is common that nurses or physicians even, there's a multitude of different errors that can occur. So nurses can mistake one bottle for another, just assuming that they know that this bottle is that medication when in actuality it's not. That the medication changed or the label changed. And then physicians are a huge problem or can present a huge problem because they handwrite all their scripts. And if we all know a physician, we all know that their handwriting is not exactly the best. And that's same for me. Like even my handwriting, I'm like, I don't really know what I wrote here. So that is a huge problem, is that if you cannot read the handwriting that's being presented to you, that increases your chance of medication errors. And unfortunately, not every hospital within the state of Arizona or even around the country is electronic. So that handwriting still presents an error. And there's no perfect solution for that. You can't make someone change their handwriting, but we can go into that in just a second. So the medication errors remain such a prominent issue that the Federal Drug Administration has a whole page on their website dedicated to talking about reducing factors that are associated to medication errors. So according to the Federal Drug Administration, there are different factors that they're trying to implement in order to reduce the chance of medication errors. Like I said, some bottles can look very similar. If we look at the Dennis Quaid twins, the nurse gave these twins a full adult dose of heparin because the bottles were slightly off in color. The adult one, I think, was dark blue, and the peds one was light blue. And if the nurse had taken the extra 2 seconds to follow her 7 rights of administration and double-checked her medication prior to giving the meds to the twins, it wouldn't have occurred. Also, though, if the manufacturer hadn't made the bottle so similar, again, it wouldn't have occurred. So the Federal Drug Administration wants to implement reducing brand names that are confusing. This will in turn reduce medication errors. Half of the medications I can't even pronounce myself. So trying to describe these medications to patients or trying to keep your LOLs and all of the medications straight is very difficult. So reducing these confusing brand names can help with medication errors and reducing that. Also, according to the Federal Drug Administration, they would like to implement a colored-based strength system. So similar to the heparin that I mentioned with the Dennis Quaid twins, one was dark blue, one was light blue. Well, now they want to implement if it's the same medication, but in different strengths, they want the bottles to be a different color. So 5 milligrams would be purple, 25 would be red. Very distinct things that will catch your eye prior to administration. And then they're also looking into seeking a new prescribing system that will eliminate that handwriting that I spoke about earlier, that it can be difficult to always read a physician's handwriting or read a nurse's handwriting. So if we can get everyone onto a new prescribing system, that eliminates this error. So if you have a physician that you can't read their handwriting and they take a script to the pharmacy is trying to read this handwriting, but they can't necessarily read it, so that can't promise that that medication who's designated for Mary Jane is going to go to Mary Jane. It could go to Mary Jo. Very similar names, however, because they couldn't read the handwriting, there is no distinct notification that stops Mary Jo from getting Mary Jane's medication. Medication errors occur more than just in a hospital setting. They occur Everywhere that there's medication, there's a medication error to be had. It occurs in a patient's home, it happens in a pharmacy, in a hospital, in deliveries, different things. There's a study that's conducted by Joseph Lau and John Iandis, in which they gathered a group of healthcare delivery drivers, so people who deliver meds to the patients, and sought to look how many medication errors occurred on this delivery route alone, or these deliveries alone. The study was based on randomized trials that were diverse, so it ranged from patients that were inpatient to outpatient, all different types of patients. Nearly more than a quarter of the medications that were delivered wrong. So they were given to the wrong person. They were given to the wrong person or sent to the wrong address or whatnot. This increases the chance that a medication error will happen again. So that is already a medication error, that the wrong medicine went to the wrong patient. But on top of that, now this patient, if they don't double check their medication, if they just trust that this delivery driver gave them the correct medication, going back to Mary J and Mary Jo got Mary Jane's medication, and now she's going to take this. And this could be something that she's allergic to. This could be something that she is going to hurt her. So there's another potential for a medication error right there. It's a trickle effect. So if the physician wrote the script and nobody can read it, the pharmacist doesn't bother to call and understand, so he fills the prescription for the wrong person. Now the delivery driver is giving the medication to the wrong person. This person is now going to take these meds, and we've had a line of medication errors, which obviously healthcare is no perfect system. Nothing's perfect, but I do believe that there's risks that can be reduced in this trickle effect here. The study does state that there are a lot of factors that could have affected that wrong medication. So like this trickle effect that I mentioned is again mentioned in the study, is that they don't know if the pharmacy messed it up, if the physician messed it up, who messed up where. It could have been that the wrong name was on the wrong medication and the delivery driver delivered it correctly, but it was the wrong person. There's a lot of different factors that they stated that they did not look into when it came to this study. So important that can possibly be looked back on. The best theoretical model that relates to this study would be the Iowa model of evidence-based practice. This model talks about how when there is a problem, there is various triggers that affect this problem. So in this case, the problem is that there's medication errors that are continuously occurring. And the triggers for this would be this trickle effect that I again mentioned, is that the person can't necessarily read the physician's handwriting, or the nurse gives it to the wrong patient, or the nurse doesn't, even in a hospital setting, the nurse doesn't follow their 7 rights of administration, doesn't double check their medication against their patient. There are many different factors that can affect this medication error, and can affect every medication error, even if the patient doesn't take the time to read the bottle. So we have medication errors at home, we have medication errors through a delivery driver, through a pharmacy, at a hospital setting, at an inpatient, outpatient setting. Medication errors can occur everywhere. And so it's important that we try to ensure that as nurses we are educating our patients, or that we're taking that extra step just to look at the bottle, just for 5 seconds, look at the bottle and make sure that this matches the order that I'm giving to my patient, to ensure that my patient's safety isn't on the line. So internally, if we as nurses ask a physician about something before walking away, so if a physician hands me a script, I make sure I look at it and I can read it, or that it's legible for somebody else to read. This will stop the script from going any further. If I can't read the script, if I have access to the script and I can't read it, then I think it's important that right then and there I ask this physician to rewrite the script, or rewrite the name, or some identifying factor that stops that script right then and there from going any further, that stops it from hurting anyone else or anything like that. And I agree with the Federal Drug Administration, how they talk about needing to find a new system so that way we can eliminate this handwriting thing, that we can eliminate that nurse cannot necessarily read it. So now the pharmacy won't be able to read it, and it's still, again, the trickle effect that I mentioned before. There's internal evidence everywhere of medication errors. If you look at any hospital, you'll find medication errors. And again, as I mentioned in the beginning of the video, no nurse is perfect. But we can reduce these errors if you just take the extra time to look at it. If you write nicer, if you have a prescription implementing system, if the pharmacy or if the drug manufacturers took the extra time to change the labels on the bottles just to make it stand out. Because nurses are busy. Sometimes we're packed with a caseload and you can't always remember to take that time. You just familiarize yourself. So again, like the Dennis Quaid twins, she was familiar with a blue bottle for heparin. Unfortunately, it was the wrong blue bottle. Ethical considerations. I don't believe that there are any ethical considerations when it comes to medication errors. I think that everyone, including from patient to pharmacist to physician, can do their part to improve and reduce medication errors. There are plenty of studies that show that, I've written a paper on a study that not every nurse reported a medication error, or there are just so many various factors. So if we can help reduce that chance of a medication error, then I think overall there will be an increase in patient safety and a decrease in the amount of fear that a nurse has on a medication error, that they will genuinely want to report that and share that information. Thank you so much for listening to my talk. I really appreciate it.